Let's turn to the return to school, which is obviously on the mind of lots of parents and teachers and children across the country. Education Secretary Betsy DeVos and the president have insisted that schools across the country need to reopen. Have you spoken to them about your recommendations and your concerns about every school taking all children in for in-person learning, even if the virus is still spreading out of control?
Jake, I have not specifically spoken to the president or to Secretary DeVos about that, but we have discussed this in the presence of the vice president at the coronavirus task force meetings, because this is obviously a very important problem. You know, in general, when I think about that, I want to take a 40,000-foot look and say, as a fundamental principle, I do agree that we should try as best as we possibly can to get the children back to school, because of the well-documented, secondary, downstream ripple effects that are negative, particularly on parents and on the children when you keep them out of school. So if you at least agree that the general principle is to try as best as you can to get the children back to school, I think you have to put that in the context that an important issue in that is to make sure you do whatever you can to safeguard the safety and the health of the children as well as the teachers. And that should guide your policy.
See, as a father, if I could just say, I would be delighted to send my kids back to school. I mean, remote learning is horrible, especially for younger kids. It's just not the way that kids are supposed to learn. But obviously, I also don't want to risk their lives or risk them picking up an infectious disease that spreads to me and my wife or their grandparents, et cetera. And this is where I come down. I don't understand why, if it's so important to our federal leadership that kids go back to school, and I agree with the principle, as you just said you do, why we don't have testing up to speed so that the day before school, kids can all get tested, teachers can all get tested, anybody who else, administrators and custodians can all get tested, and then there can be tests at the school every 2 weeks or so, with obviously everybody washing their hands, wearing masks, et cetera. I would feel much more comfortable. And yet what I'm hearing from the federal leadership is go back to school, and nothing along the lines of, and here's how we're going to protect your children.
Well, there are so many different models of that. And I think what's being discussed now, Jake, is different types of approaches to do what I just said, to adhere to the principle of getting the children back to school, but in order to safeguard them, their health and their welfare, as well as the teachers, to do some sort of modeling that are different versions. And I've heard different versions from different principals and different superintendents about the school scheduling, about morning, afternoon, about alternate days, about more outdoor than indoor if you possibly can, protecting the vulnerable, but also what you're talking about testing. Although I haven't heard it discussed in detail about elementary or middle school, clearly many of the universities are talking about the same model that you're talking about, that are more universal testing before you get in, and intermittent at different intervals surveillance testing. That clearly is being discussed at the level of universities and colleges. Whether or not that is even going to be discussed with regard to elementary and middle and other schools, I'm not sure.
The U.S. Surgeon General today, Dr. Jerome Adams, said that the U.S. needs to lower the transmission rate to get schools reopened. I want to play for you something I heard from Missouri's Republican Governor Mike Parson. This is what he had to say this week about students returning to school in the fall.
These kids have got to get back to school. They're at the lowest risk possible. And if they do get COVID-19, which they will, and they will when they go to school, they're not going to the hospitals. They're not going to have to sit in doctor's office for days. They're going to go home, and they're going to get over it.
I mean, just to repeat it, the governor said the kids who get it, he said they will get it. They're not going to have to sit in doctor's office. They're not going to hospitals. They're going to go home, and they're going to get over it. What's your reaction to that?
Well, I mean, in general, children who get infected, as we know from the statistics, clearly, for the most part, do very well. And don't get seriously ill. If you look at the rate of hospitalizations, it's much, much, much lower with children. But there are exceptions to that. And I think we have to be realistic to realize that children who get infected, for the most part, don't get serious illness, but some children do get seriously ill, and some do pass it on to the adults. So I think we have to be careful when we talk about that.
Finally, sir, I know you're a huge Nationals fan. I've seen you wear a Nationals mask at hearings. You're going to throw out the first pitch when the Nationals face off against the Yankees on opening day, Thursday. Obviously, that's quite an honor. How are you going to do it in a way that conveys that we're not going back to normal, that this is baseball during a time of a pandemic?
Well, Jake, I think the atmosphere in which it's going to be occurring is going to speak that very, very clearly. There's not going to be people in the stands. It's just going to be televised. So I think that in and of itself tells you something about the stark difference between what we're doing right now and what we were able to do last year at this time.
All right. I hope you've practiced. That plate is a lot farther than you think it is.
Yeah, I used to play baseball as a young boy and as a kid in school, and I hope I don't bounce it too much.
Well, if you do, you'll be forgiven. I know you've been busy. Dr. Antony Fauci, thanks so much for being so generous with your time and expertise today. We appreciate it.
Thank you for having me, Jake.